The Child in the Womb. A 10-minute educational story on alcohol use during pregnancy. Julie did not know that the first decision she made after missing her period would echo for the rest of her child's life. It was a humid evening in Oja, Lagos, and the sound of traffic mixed with distant music from a roadside bar. Julie, 27, sat on a plastic chair outside their apartment, holding a small white stick. 2 red lines stared back at her. Pregnant. Her heart raced. Not with fear, but with confusion. Inside the room, Steve, her husband of 2 years, 30 years old, was watching the evening news. "Steve," she called softly. "Yes, babe. I think I'm pregnant." Steve smiled. "That's good news, isn't it?" Julie smiled back, but deep inside, a quiet storm was already forming. The habit no one talked about. Julie was a marketing executive. Smart. Educated. Confident. She loved social gatherings, weddings, and office hangouts. And like many young professionals in Nigeria, alcohol was part of her social life. A bottle of wine after work. A few shots at weddings. Occasional cocktails with friends. When she found out she was pregnant, she didn't stop completely. "It's just small," she told herself. "People drink and still give birth normally. My grandmother drank palm wine and we turned out fine." Steve didn't question it either. As long as Julie wasn't drunk, he felt everything was under control. What neither of them knew was that there is no safe amount of alcohol during pregnancy. What alcohol does inside the womb. At 12 weeks pregnant, Julie attended her first antenatal class at a government hospital in Yaba. The nurse spoke clearly. "Any alcohol a pregnant woman drinks goes straight to the baby," she said. "The placenta cannot filter alcohol." Julie shifted uneasily. The nurse continued. "The baby's liver is not developed enough to process alcohol. So alcohol stays longer in the fetus body, damaging developing organs, especially the brain." Julie swallowed hard. Alcohol exposure during pregnancy can cause poor brain development, facial abnormalities, low birth weight, heart defects, learning and behavior problems. This condition is called fetal alcohol spectrum disorders, FASD. Julie told herself, "But I don't drink every day." What she didn't know was that even occasional drinking can harm a developing fetus, especially in early pregnancy. The silent damage. By the second trimester, Julie noticed the baby didn't move as much as expected. At the scan, the doctor frowned slightly. "The baby is smaller than average," he said gently. "Have you been taking alcohol?" Julie hesitated. "Just wine sometimes." The doctor looked at her seriously. "Madam, there is no safe alcohol in pregnancy. Alcohol interferes with brain cell formation. It can reduce intelligence, affect memory, and damage behavior control." Julie felt ashamed. But habits are difficult to break. At her cousin's wedding in Ibadan, she drank again. "This is my last one," she said. But the damage had already begun. Birthday. Julie went into labor at 36 weeks. The baby arrived crying but weak. A boy. They named him Daniel. He was underweight. His head circumference was small. His face looked slightly different, smooth upper lip, thin upper lip. The pediatrician spoke quietly. "We will monitor him closely." Julie and Steve went home happy yet uneasy. The first signs after birth. By 6 months, Daniel struggled to sit. By 1 year, he wasn't speaking like other children. By 2 years, his behavior became difficult. He cried excessively. He couldn't focus. He didn't respond to instructions. He was aggressive without reason. At daycare, the teacher called Julie. "Your child is intelligent, but he struggles to concentrate. He is hyperactive and impulsive." At age 4, Daniel was diagnosed with fetal alcohol spectrum disorder. The doctor explained, "This is a permanent condition. It affects learning, behavior, emotional control, and social skills." Steve's hands trembled. Julie broke down. "I didn't know," she cried. "I didn't know how alcohol affects the child after birth." The doctor explained carefully. Children exposed to alcohol in the womb may have learning difficulties, struggle with memory, have poor judgment, be hyperactive or impulsive, have trouble in school, find it difficult to form relationships, be vulnerable to mental health issues later in life. These children are not stubborn, the doctor said. Their brains were injured before birth. Julie felt crushed by guilt. The emotional cost. Steve became quiet. Medical bills increased. Therapy sessions became routine. School became a struggle. Julie left her job to focus on Daniel. Every time Daniel threw a tantrum or failed an exam, Julie remembered the wine glasses, the alcohol that felt harmless, the advice she ignored. The turning point. At a women's health seminar in Sarulea, Julie stood before other pregnant women. Her voice shook, but she spoke. I was educated. I had access to information. But I believed myths. She held up Daniel's picture. Alcohol doesn't just affect pregnancy, it affects a lifetime. The room was silent. Final message, strong educational conclusion. Alcohol during pregnancy crosses the placenta, damages the fetal brain, has no safe level, causes lifelong disabilities, is 100% preventable. Julie learned too late, but her story saved others. Closing line. Some choices last longer than 9 months. They last a lifetime.